most famous physical therapist on the internet.
They called you Hinder?
Occasionally, Bob. I had thick skin. I could take it. I could laugh with them.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Heineck.
therapist. Yes.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Okay, today we're going to talk about there's no way you can help my sciatica. Wrong. We're going to give you some simple tips here, and we're going to have a program for you that you can go to
Oh, that's
address
right.
all the
Something
issues.
so you can dependably go to it.
Yeah, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. If you're wondering what this is, it's a little sample of a mattress that we're going to give away.
A Sleepovation mattress.
A Sleepovation mattress. We're giving away a full one. You can also go to Facebook. It'll be pinned at the top of the page, the contest. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. This mattress has 700 individual tiny mattresses that are really super comfortable. It's got a proprietary foam that conforms to your body but rebounds quickly.
Oh, yes.
Each one's got a spring underneath it. Yes. It's got air channels here. Yeah. It's a good, if you have pain, this is your mattress.
I don't worry about all those details. I just know it feels very comfortable, Bob.
Well, thanks for all the help, Brad.
Yeah. So one thing I did want to mention, Bob, was that I think we should get on with the program.
All right.
Wait. We do have a podcast.
Oh, yeah, we have a podcast.
Which is very good.
All right. So number one thing, if you have sciatica, one thing you got to look for any improvement at all. I have a nephew that's going through this right now, and I know he's sick of it, and he wants to be gone. He wants to be better, and I understand that completely, but it does take time. It took a long time to develop sciatica.
Sure.
And it takes a while to get rid of it, and you got to look for the small improvements.
Sure.
And if something's working, you got to stick with it and not give up on it.
Right.
So surgery should be the last option. In fact, I've done a lot of reading on this. I listened to the experts on this. We're having Stuart McGill on our podcast coming up, and he's the world's foremost expert on back pain. And he is not a big fan of surgery at all unless you have weakness and pain, going down into the foot.
Extreme symptoms in the sciatic
It's
world.
a last resort. He, in fact, recommends trying fake surgery because he thinks a lot of times your back gets better, not because of the surgery, but because you rested it. Mm-hmm. And so what he'll say is pretend like you had surgery. And, next couple of days, you rest the back. You don't do any strenuous type exercises.
Right. These are what the surgeon's going to tell you after you get done. And so,
and you maybe wear a brace for a while.
You're not going to work.
You're not going to work. And then you are slowly going to start doing exercises, which in therapy we would have you do, like stabilization exercises and try all that. You could say, well, I can't do that. I got to work. And well, what are you going to do if you have surgery? You're not going to be working then.
Right.
So anyway, it's worth a try.
If you can do it, because it might be hard to tell your boss,
right,
I'm having fake surgery. I got to take a few weeks off.
I'll write your note. Okay, the next thing is to make sure you start your day off right. A lot of times I think people get out of bed incorrectly, and right away they go, oh, my pain's back. And they can't even get out of bed without getting a bad reminder that the pain is...
Psychologically, that's a terrible way to start your day.
So I'm going to show you first one way, and Brad's going to show you another way to get out of bed. Now, with sciatica, let's say you're starting by lying on your back here. You don't want to twist like this. You want to roll your whole body as a log like this, and then you can bring your leg off and push up with your arms. Now, another key to that, though, the entire time when you start from this position, I want you to tighten up your abdomen.
Right.
Tighten up so like if you took your fingers and tried to poke them in there, you wouldn't be able to.
You can feel those muscles contracting.
Yeah. So tighten up, keep it tight all the way until you're sitting up.
Right.
Now, Brad's going to show you another method for getting out of bed.
If that's not working, it's just too tender and that much movement is not acceptable, this would be the next way. If you're really in sore shape, I've had a number of people do this. Teach them in the clinic. I teach them how to do it, getting off the table like this, and then say do the same at home. So you got to get far enough away from the side so you log roll just like Bob did.
And again, you can tighten your abdomen.
Right there, tighten, slowly get to your stomach. And at this point, you're going to slide your hips, not your shoulders, just your hips, over to your left leg, or the leg farthest out touches the floor, so you know it's there. Tighten up the stomach, keep the back straight and neutral. Breathe, tighten, go up, and you can see my back isn't rounding like this. I've got it nice and straight. Use your arms for support to get to that upright position with good posture. And there you are. So you don't get that stabbing pain right out of bed.
Brad, do you mind grabbing another cup over there?
Oh, no.
And you might as well bring the model right away, too.
Of course. I'll bring the model.
The most important thing you can do for your sciatica is we're going to try to have you avoid things that irritate the nerve or irritate the back. It's as simple as, well, my thumb hurts because I'm taking a hammer and pounding it. You got to stop pounding it.
Exactly.
And really, so like, let's say you're able to sit for 20 minutes and you start to have pain. Sit for only 15 minutes. Don't even push it to that point. If something's bothering you or causing pain, you need to figure out a way to do it without pain.
Either stop doing it or modify it.
Exactly. And we're going to show you later how you can do some of those things. But right now, one of the things that typically when you have sciatica, it's very often a disc problem. And you have, I'm taking these two bones from the lower back, and I'm actually showing the disc that's in between.
Right. So this is a vertebra. This is a vertebra.
Yep.
The disc.
I'm facing this way. These are the little bumps you feel on your back. Right. Now, Brad, show me what you don't want to do. You don't want to, you don't want to bend forward like that, because if you do that and you have a disc problem, now on a normal healthy disc, it's not a problem, but on a disc problem, it can actually cause it to bulge out like this and press against the nerve.
Right.
Now we're going to show you on an actual model here too. This is actually a really good model from Dynamic Disc Design. And Brad's going to create a little room here.
There we go.
Space. So we got the model here. Here's the disc problem. And I'm going to bend over.
So just like when I was bending forward,
Right.
not very good back
Oh,
mechanics.
I'm on the wrong one. I'm on the wrong side.
Oh, yeah.
All right, here we go. Now we're going to bend.
Here's the nerve that goes down the leg.
Yep.
You can see right there. See that bulge or that herniation pushing into that disc right there. Let it go back in, Bob.
Pressing into the nerve.
Oh.
Yeah.
So the goal is to change your posture or your body mechanics so that does not come out and push into that nerve.
Exactly.
Very mechanical.
Yes. And you just want to avoid anything that's going to, put yourself in that position.
Right.
So one of the things is we actually tell you to avoid sitting.
Right.
Because even with sitting in good posture, it's difficult to not put stress on that back.
Right.
So I had an episode of sciatica when I was 20 some years old. I didn't sit at all. I was working as a therapist as a student.
Sure.
And I would do my notes standing up.
Yep.
I'd treat my patients standing as much as I could.
Mm-hmm.
And I just avoided it. My nephew, who again is having trouble with sciatica, he would study by going to the edge of the bed like this, Brad. And he would lean, he put his book here, and he could go like this, and he could keep his back straight.
Yeah.
And even put a little traction on it, because he's leaning against with the elbows on the bed.
So you got to modify it. You'll know, because if you have it wrong, it's going to hurt.
It's going to hurt, right?
Pain down the leg. Those sciatic symptoms are coming back. It's a big red flag. You're doing something wrong when the sciatic symptoms.
Yeah, you
get
don't
worse.
even want to test it. You don't want to even go, oh, does that still hurt?
Sure.
Oh, yeah, it does. I mean, how you calm the nerves down is by stop irritating them.
Sure.
Next thing, we want you to walk, and again, Stuart McGill is going to be on our podcast. If you have some questions for him, you should email or put them in the comments. But one thing he recommends is for someone with back pain, he recommends walking 4 times a day.
Okay.
He says like after every meal,
Yep.
and then throw another one in there.
Right.
And even if it's only for 10 minutes, but he says for like 20 minutes.
Sure.
And it's a huge effect on your back. It gets more blood flow to the area. It helps it start to heal.
And when you're walking, you're upright, you're in good posture.
Yes.
You know, unless you happen to be a flex forward walking, you're not aware of it. Maybe that's
The
if
part
it
of
is,
the
you know, if
problem,
you're not
right.
tolerating walking.
He talks about walking at a faster pace.
Sure.
There's actually less stress on your back when you walk at a fast pace. And I've seen this with patients. They won't believe it. They'll come out limping in, and I'll go, walk faster.
Sure.
And it actually, they were able to do so. And the smile on their face,
Sure.
you know.
Walking around real fast.
Right. All
so,
right.
I'm assuming he talks about walking on even surfaces,
Right.
not up and down hills,
Yes,
etc. 'cause
exactly.
that's
Good point,
important.
Brad. Number 6, this is probably one of the best things you're going to be able to do. We have a whole program on sciatica
Mhm.
on our website. It got like 40 videos. You can watch the ones that pertain to you.
Right.
You just go to bobandbrad.com, go to the program section,
Right.
and look for the one on sciatica.
Right.
And that's going to help you because it's going to have all the exercises you should do
Yep.
and try.
Yep.
And
So again, pick out the title that pertains to, you'll know. Watch the video. There's a bonus, there's a PDF printout. Click on that, print it out at home, and then you have a complete review of the whole video with exercises right there. It's just a wonderful way to approach
and it's
this.
free. I know
Yeah.
you're thinking that we were talking about this, like, okay, what's the catch? There's no
Mm.
catch. It's our gift to you, and it is worthwhile.
We don't even ask for an email.
All right, this we're going to cover this also in the program, the Sciatica program, but your sleeping posture. So I'm just going to show you 2 possibilities, and you can see if any of those help you sleep, because it's very important that you're able to sleep without pain too. So the first one, Brad, you want to grab the leg wedge?
I
there?
do.
I'm going to lie down, and this again, my nephew couldn't sleep at night, and so I sent him a leg wedge. And he was able to sleep then for a few hours, and eventually got to sleeping all night.
Sure.
But for whatever reason, you kind of gaps the back a little bit and takes pressure off that nerve. You may want to try some pillows first to see if it helps you. If it does, the leg wedge is better.
Yes.
Right. Brad uses one all the time.
Well, only when your back's
when your
bothered.
back's bothered, yeah.
Right. But yeah, I got to admit, there's been a few patients that did not tolerate it well,
Yeah.
so we can't guarantee it, but I'd say 90% of the patients I've used these on there, you put it there and they're smiling and they say, I'd like to have one at home.
Well, one thing you could do is you could lie on the floor and actually put your foot up on a stool or a chair.
Right.
And see if that relieves it. If that relieves it, that's usually a pretty good sign that it will help.
Exactly.
All right, the other one for sciatica, and this is in the program too. If you sleep on your side, let's say you're getting pain down the left leg, the upper leg right here. What you're going to do is you're going to take a pillow and put it underneath your ankle and foot. Now try one pillow and see if that takes away the pain. If it doesn't, try 2 pillows. And a lot of times that opens up the spine here a little bit and takes the pressure off the nerve, and people are able to sleep that way for a while then, until they thrash around and knocks the pillows out of the way.
Right, but at least you get
to sleep.
Yep.
Right.
If it doesn't feel good, don't force it.
We're looking
just take the pillows and
we're looking for
disregard it.
immediate pain relief on
Right.
that.
Mhm.
So again, go to the bobandbrad.com, go to that program section, and you're going to get all the help you need on sciatica. Check it out. Guaranteed.
It's a plethora of videos specifically for your needs.
Yeah.
How is that?
I like it, Brad.
Yeah, I stayed up late last night trying to figure that phrase.
Okay. Good for you.